Hypertension, often called high blood pressure, is a common condition. It affects millions of people worldwide. Blood pressure is the force of blood pushing against the walls of your arteries. When this force is consistently too high, it puts extra strain on your heart and blood vessels. Think of your arteries as highways and your blood as the traffic. Just like too many cars on a highway cause congestion and slowdowns, high blood pressure means your heart has to work harder to pump blood through your body. Over time, this constant strain can damage your arteries and increase your risk of serious health problems. The dangers of uncontrolled hypertension are significant. It's a major risk factor for heart disease, stroke, heart failure, vision problems, and kidney disease. The scariest part? Hypertension often has no symptoms, earning it the nickname the silent killer.
The good news is that hypertension is treatable. By understanding how different types of antihypertensive medications work, you can take control of your health and lower your risk of complications.
Diuretics, sometimes called water pills, are often the first line of defense against hypertension. They work by helping your kidneys remove excess sodium and water from your body through urine. This reduces the volume of blood in your blood vessels, which in turn lowers your blood pressure. Think of diuretics as opening a pressure valve in a water pipe. By releasing some of the water, the pressure inside the pipe decreases. Hydrochlorothiazide, furosemide, and spironolactone are common examples of diuretics. While generally safe, diuretics can sometimes cause side effects like frequent urination, especially when you first start taking them. They may also lead to electrolyte imbalances, so your doctor will monitor your blood levels regularly.
Beta blockers are another class of drugs used to manage hypertension. They work by blocking the effects of the hormone epinephrine, also known as adrenaline. Adrenaline speeds up your heart rate and makes your heart contract with more force, both of which increase blood pressure. By blocking these effects, beta blockers help slow down your heart rate and reduce its workload, ultimately lowering your blood pressure. Imagine your heart as a racehorse and adrenaline as the jockey urging it to go faster. Beta blockers act like reins, gently controlling the horse's speed. Atenolol, metoprolol, and propranolol are some commonly prescribed beta blockers. They are effective in lowering blood pressure, but can cause side effects like fatigue, dizziness, and cold hands and feet.
Angiotensin-converting enzyme inhibitors work by interfering with the renin-angiotensin-aldosterone system, a complex hormonal cascade that regulates blood pressure. Renin, an enzyme produced by your kidneys, sets off a chain reaction that ultimately leads to the production of angiotensin II, a powerful vasoconstrictor. Vasoconstriction is the narrowing of your blood vessels, which forces your heart to work harder to pump blood through them, increasing blood pressure. AC inhibitors block the enzyme that produces angiotensin II, preventing vasoconstriction and allowing your blood vessels to relax, thereby lowering blood pressure. Think of ACE inhibitors as intercepting a messenger carrying orders to tighten the blood vessels. By blocking the messenger, the orders never reach their destination and the blood vessels remain relaxed. Enalapril, lisinopril, and ramipril are examples of AC inhibitors. A common side effect of ACE inhibitors is a persistent dry cough, which occurs in some people due to the buildup of bradykinin, a substance that normally breaks down in the lungs.
Section 5, a different approach. Angiotensin II receptor blockers, or ARBs. Like ACE inhibitors, angiotensin II receptor blockers also target the RAAS, but they work at a different point in the cascade.
Instead of blocking the production of angiotensin II, ARBs prevent it from binding to its receptors on the blood vessels. Think of it this way. If ACE inhibitors intercept the messenger carrying the orders to constrict blood vessels, ARBs lock the doors to the receiving office, preventing the messenger from delivering the message.
This blockade prevents angiotensin II from exerting its vasoconstricting effects, allowing your blood vessels to relax and your blood pressure to decrease. Losartan, valsartan, and irbesartan are examples of commonly prescribed ARBs.
ARBs are generally well tolerated, but can cause side effects similar to ACE inhibitors, though the persistent cough is less common.
Section 6. Relaxing the blood vessels. Calcium channel blockers. Calcium channel blockers, as their name suggests, work by blocking the entry of calcium into the muscle cells of your heart and blood vessels.
Calcium is essential for muscle contraction. By limiting calcium influx, these drugs cause the muscles in your blood vessels to relax and widen, lowering your blood pressure. Imagine calcium as a key that unlocks the door to muscle contraction. Calcium channel blockers act like a key blocker, preventing the door from opening fully and allowing the blood vessels to relax.
Commonly prescribed calcium channel blockers include amlodipine, nifedipine, and verapamil. Side effects can include headache, dizziness, and constipation. Section 7. Targeting alpha receptors. Alpha blockers. Alpha blockers work by blocking the effects of norepinephrine, another hormone that contributes to vasoconstriction.
Norepinephrine binds to alpha receptors on blood vessels, causing them to constrict. Alpha blockers block these receptors, preventing norepinephrine from binding and allowing the blood vessels to relax. Think of alpha blockers as putting up road-closed signs on the alpha receptors, forcing norepinephrine to take a detour and preventing it from constricting the blood vessels.
Prazosin, terazosin, and doxazosin are common examples of alpha blockers. They are effective in lowering blood pressure but can cause side effects like dizziness, lightheadedness, and fatigue, especially when you first start taking them.
Section 8. Calming the nervous system. Central alpha agonists. So central alpha agonists work differently than other antihypertensive medications.
Instead of directly targeting blood vessels, they act on the central nervous system to reduce nerve signals that constrict blood vessels.
This results in decreased nerve activity, leading to relaxation of the blood vessels and a reduction in blood pressure.
Think of central alpha agonists as turning down the volume on a loudspeaker that's amplifying nerve signals that constrict blood vessels.
By lowering the volume, the signals become weaker and the blood vessels relax.
Clonidine, also known as Catapres, and methyldopa, known as Aldomet, are examples of central alpha agonists.
They can cause side effects like dry mouth, drowsiness, and dizziness.
Methyldopa is generally reserved for pregnant women with high blood pressure because it's considered safe during pregnancy. Section 9. Widening the vessels. Direct vasodilators.
Direct vasodilators work exactly as their name implies. They directly relax the muscles in the walls of blood vessels, causing them to widen and allowing blood to flow more easily, thereby lowering blood pressure. Imagine direct vasodilators as gently stretching a rubber band. As the rubber band stretches, it becomes wider and the tension decreases. Similarly, direct vasodilators relax and widen the blood vessels, reducing blood pressure. Hydralazine, also known as apresoline, and minoxidil, known as Lonitin, are examples of direct vasodilators. They are potent blood pressure reducers, but can cause side effects like headache, rapid heartbeat, and fluid retention.
Section 10. Inhibiting renin, a novel approach.
Renin inhibitors represent a newer class of antihypertensive medications. They work by blocking the action of renin, the first enzyme in the RAS cascade mentioned earlier. By inhibiting renin, these drugs prevent the cascade of events that leads to the production of angiotensin II, ultimately preventing vasoconstriction and lowering blood pressure. Think of renin inhibitors as shutting down the factory that produces the messengers that tell blood vessels to constrict. Without the messengers, the blood vessels remain relaxed and blood pressure remains lower. Aliskiren, also known as Tectorna, is an example of a renin inhibitor. While generally safe, renin inhibitors can cause side effects similar to those of ACE inhibitors and ARBs, including cough and electrolyte imbalances.
Section 11. The importance of personalized treatment.
Managing hypertension effectively is not a one-size-fits-all approach. What works for one person may not work for another. Factors like age, race, overall health, other medical conditions, and individual responses to medications all play a role in determining the most effective treatment plan. Finding the right medication or combination of medications and the right dosage is crucial for achieving blood pressure control and reducing the risk of complications. Your doctor will work with you to develop a personalized treatment plan, taking into account your individual needs and medical history.
Section 12. Conclusion. A lifelong commitment to heart health.
Hypertension is a chronic condition that requires lifelong management.
While medications are essential for controlling blood pressure, lifestyle modifications are equally important.
Regular exercise, a healthy diet low in sodium and saturated fats, maintaining a healthy weight, limiting alcohol intake and quitting smoking are crucial for managing hypertension effectively.
Regular monitoring by your healthcare provider is also essential to ensure your treatment plan is working and to make adjustments as needed.
Remember, taking an active role in managing your hypertension is the key to living a long and healthy life.